Moving on back to malaria, of course, it is not every fever that people come down with that translates to malaria. And to this end, stakeholders in the nation's capital want an improvement in access to testing, treatment and tracking of malaria.
Now, they made this call at a conference to mark the 2017 World Malaria Day. TVC's Kim Balogun reports now.
It is the 17th commemoration of the World Malaria Day. This year's theme is End Malaria for Good, and the Nigerian government and other stakeholders are highlighting its achievements in the battle against malaria and the need to improve on funding and strategies to bring malaria to its knees by the year 2030. In Nigeria, the drive is to end malaria mortality by 2020 through the use of the 3 T's: testing, treatment and tracking. Ending malaria will not only reduce the 80 million illnesses that are related to malaria, but will also cut down on the 300,000 deaths that are recorded due to malaria.
Not every fever is malaria. And so we must improve our ability to make a diagnosis. Malaria, as we've been told, is our #1 public health challenge in this country. Take malaria out of the table, the room, the environment, this country, many things will change. Our maternal mortality and under-5 mortality will significantly improve. The contribution of the workforce to economic development will also significantly change.
We stand committed together as a global community to end this terrible disease for good. And we will do this by reminding ourselves of our individual and collective roles to make this happen.
The governor of Zamfara State has taken steps to ensure that his state is one out of a few within the country that have ensured that malaria is significantly reduced.
Our administration, with the support from the United States President Malaria Initiative, the United States Agency for International Development USAID, and the Health Communication Capacity Collaboration, distributed about 2.6 million long-lasting and society-treated nets across Zamfara State. All pregnant women are being given the nets and drugs for free in all state government-owned hospitals and other health facilities. I would like to assure that Zamfara State government will continue to sustain the fight against malaria.
Although there have been achievements, but the challenges still remain due to problems of self-medication, lack of proper access to testing and treatment, especially for those in rural communities where there is no access to proper health care. Kemi Balogun, TVC News, Abuja.
Yeah, self-medication obviously is a major problem. We have Dr. Tui Mebaondu on the line. Good morning. Thanks for joining us.
Good morning.
Yes, now talk to us about how self-medication is actually complicating the malaria scourge in this part of the world.
Well, thank you. As a preliminary, we know that we have more than 400,000 cases of malaria every year. Sub-Saharan Africa is the culprit, is the greatest receiver of the malaria burden. And we see 90% of cases and more than 90% of deaths of malaria is seen in this part of the world. Now, as much as we have achieved elimination, that means zero transmission of malaria, no malaria at all in some countries. And we've seen about even more than 11 countries on pre-elimination, stage. Even countries that are poorer than Nigeria. We've seen a lot of challenge in trying to address malaria scourge in this country. Now, we first of all, the information gap. There's a big information gap. People don't honestly, especially at the rural area, understand what they need to do. And even once they have malaria, access to proper treatment of malaria. Now, because there's no access to proper treatment, because they don't understand at the local level the basic algorithm to deal with malaria, what we get is that they resort to all sorts of treatment, and then especially self-medication. And then this then gives us to perpetration of even some difficult strain of the parasite and even complication of malaria, especially amongst the children. Now, in this rural area, they don't have that, sufficient access to drugs, okay? Even when the drugs are given, it's not impressed on them the need to use the drug adequately and complete the dose. completion of the dose is key to actually complete the treatment of malaria. Now, even this common thing that you give to them, that's for them to sleep under insecticide-treated nets, is becoming a challenge. Because even those nets, when they are deployed, people rarely use them. So why do you have self-medication? Because, again, the proper diagnosis, the proper tool for them to understand what they need to do.
All right, Dr. Mibawanju, thank you. That's the much time can permit us right now. Thank you very much for talking to us. Well, it's a whole celebration or commemoration ahead.
Or marking.
Or marking ahead because it's a long day. But however,
yes,
across the world, people will be talking about creating more awareness about malaria
and
today.
aren't we all guilty, really, of self-medication? And we're complicating things for ourselves.
A lot of people.
Yeah.
All right, this is where we round off for today. Tomorrow will be time for another program to talk about other issues. I am Mike Okwache.
And I'm Ngozi Alibu, wishing you a beautiful Tuesday. But we'll leave you, of course, with the weather outlook from major cities across the world.